We're learning more about grant money that will help healthcare not just in the doctor's office, but where you are. Three Rivers Ambulance Authority received a $40,000 mobile integrated healthcare grant. And joining me to talk about it, TRAA CEO Joel Benz and Chad Ford. How you gentlemen doing this morning?
Good morning.
Good morning. So talk to me, what is this grant going to do for you guys?
Yeah, so I think the main thing is it really shifts us from being reactive, where we send an ambulance to provide care, to more proactive, and so preventative care, actually helping patients never have to call us, and that's really a shift, paradigm shift for us a little bit, but we think that there's a lot of data out that says that actually improves outcomes long-term for a community, and so we're really excited to delve into that. And so Chad has been really probably deserves a lot of the credit for kind of putting this program together, putting together the policies and procedures and things like that. So there's probably 9 areas that really we're looking at delving into, and you want to talk about those, Chad?
What does that look like for the person at home? What does this grant do for them?
Well, a lot of it is when they get released from like the emergency room or from the hospital, they go home. A lot of times we hear about insurance releasing them early. So they go home, we go out and we will help, kind of help them not be readmitted into the hospital. We will help them find ways and resources. We will do patient assessments and provide care at their home prior to them having to go back into the hospital. We'll work with maternal and paternal care. We will work with drug overdoses. We will work with substance abuse and mental health issues.
Yeah.
What does that mean to you guys that you're going to have this resource to be able to reach out? Like you said, be proactive and not just reactive care.
Yeah, so actually we've been doing it for a couple of years at just an outreach level where we go and connect them with resources, and this actually allows Chad to actually treat the patients there rather than them having to go to the hospital. So that's like the most expensive mode of transport to basically the most expensive level of care is emergency care. And there's a population of patients that we are their primary healthcare provider, and so this allows him, rather than having to go through all that or take those patients through all that, to treat them right where they're at, and then that again leads to better outcomes for those patients. They never get into the healthcare system. There's a way reduced cost to that, and so it's better for the whole community, really.
I think my last big question for you, Chad, is what's that feeling like, knowing that you guys are going to be able to do more of this work? Like you said, it's a lower barrier, it's a less expensive work, getting to go and work with people where they are, not in kind of the foreign place of the emergency room.
I've been in EMS for a long time, and this is a different aspect of EMS. As Joel was saying, we've done really well at being reactive. So I've spent most of my career being reactive. Now I get to go out and do preventative, and I get to help them in their point of where they're at, and help them to feel better before they even need to get into the emergency setting.
That's awesome. Well, hey, thank you guys so much for your time this morning. Really appreciate you joining us. That $40,000 grant will once again help preventative care, and TRAA will begin investing that money in the program this year, although, as you said, it already has been running. You can catch a recap of this interview and all the information you need to know later today on WANE.com. Still to come on First News Saturday.